Hi, everyone. I'm Dr. Sam Lamb. I'm the chair for the Berlin meeting for the ISHRS this year on October 23rd to 25th, 2025. I'm honored to invite Ulrike Blume-Peytavi, who is professor of dermatology and allergology at Charité-University in Berlin. And she's going to be talking to us about topical finasteride, which is going to be her featured speech. Can you tell us a little bit about that? I know you've really been one of the major coordinating investigators, and the research, a lot of the groundbreaking work has been done in Germany about topical finasteride.
Yes, thank you very much. I'm happy that you are interested in topical finasteride, because I think topical finasteride has been developed because there are so much discussion on possible side effects of oral finasteride. However, there was a need to develop a topical formulation to offer it to a broader spectrum of people. And we investigated whether topical finasteride has the same side effects and also same efficacy as oral finasteride. And this is very important because, in fact, in this phase 3 clinical study, which was the one which allowed permission to the market in Europe, was showing that, in fact, the effect in hair density and in hair width was the same as oral finasteride. However, the level of the serum level of finasteride was half the amount of what is given, what is achieved when given orally, but also the reduction of testosterone to dehydrotestosterone metabolization. We could show that, in fact, the effect by this enzymatic inhibition was the same. So, in fact, but side effects were significantly lower to none in topical finasteride as recorded in our study.
And did you, so your goal is to not reduce serum DHT, is that correct?
Exactly. It is, in fact, to have it reduces also serum DHT, but it is significantly lower than with oral finasteride.
And I know you did some work because of some of your initial work actually over-reduced the serum DHT. What did you do to try to compensate for that problem?
In fact, there was a dose finding study to see which amount of topical finasteride leads to a lower reduction of DHT while having the same efficacy. And this is a dose which is licensed now in the final formulation. So in fact, it's a dose-dependent effect. The more you give, or if you would give a higher amount, we could also achieve a higher reduction of DHT. But in fact, it's a balance of effect and dosage.
Did you find that you needed other ingredients to balance the penetration, to improve penetration or reduce it escaping into the blood to create too much reduction in DHT, or was it just a question of percentage of the actual topical finasteride?
The formulation in the dose finding study was the same, so it's not a penetration enhancer. The formulation of topical finasteride is comparable to what we know from topical minoxidil solution. And in fact, it is more the amount of drug in the formulation which leads to the reduction.
What general percentage did you find to be the most efficacious in terms of not having the side effects, but having the efficacy that's comparable to oral?
It's 2.25 milligram, what we have in the spray, what is currently used. And you can use 1 to 4 spray. So you can use it on the forehead in the triangular region, and you apply it also on the vertex. You can have up to 4 sprays per day. It's 50 microgram of this dosage, what you apply, and you apply it with an applicator. So the aerosol, it only reaches the region, the target region where you want to apply it, and it's not volatile around the head, and it's really going to the target area.
Have you tried any work on topical dutasteride at all?
No.
Okay. I think that would be very interesting research. Also, just because the long half-life. The question is, would that become problematic on a topical level?
just
challenging a thought for
Yeah,
future
but
research.
of course, it can be very interesting if you want to use topical finasteride compared to topical dutasteride. However, you should always look when you have a topical application, you have a penetration, and the penetration enhancer leads you to the deeper follicle, and it leads you also to the perifollicular network. So the question is whether there's really an advantage of using topical dutasteride, because it would be a question of formulation that remains within the hair follicle and is at the target area. It's different when you have a level of dutasteride in the blood, which has a lower metabolization rate. So the half-life is longer in dutasteride.
Right.
But with topical application, you should keep it at the target area. So I'm not, then you would more play on the systemic level you can achieve with topical dutasteride. So it might be interesting, but it's a question of amount you let penetrate and let persist, or it's a retarded delivery in the topical area of the hair follicle down.
True. Just good thought. This good thinking for future ideas. But
Yeah, of course.
and we're very excited to have you in your hometown, where we're going to be running this meeting. I'm very excited to be the chair for this, and so I encourage all of you to sign up. As chair, I'm really proud to say this is going to be a very amazing Congress that's going to be very practical. You're not going to walk home with 1 or 2 pearls. You're going to walk home with hopefully 100 to 1,000. That's my goal. Thank you very much.
Thank you.